Let's grab our foam roller and we're going to bring our purple loop band around our outer thighs. That's the purple loop band. We'll come onto our knees with the shins and the tops of the feet on the ground. I'll be profile to you so that you can see what's happening with my torso. So I'm going to create a diagonal for my knees out through the crown of the head, neutralizing my pelvis, so that's somewhere between rounding and arching the back, pulling the belly in towards the spine, lifting in and up on the muscles that stop my stream of pee. Knees are hip distance apart, shins and tops of the feet are pressing into the floor. I'll inhale, taking the roller overhead, hinging back. Exhale, turn my head right, left, right, left. Inhale, pause, centering the head. Exhale again, turn the head right and left, right and left. Inhale, back up to center. Roller comes back in line with the chest. And exhale, inner thighs pull you back into the diagonal. Inhale, prepare. Exhale, turn the head right, left, right, left. Inhale, center. Again, exhale, turn the head right, left, right, left. Inhale, back upright. Continuing, inner thighs pull you back. Belly braces in, lifting in and up on the muscles that stop the stream of pee as you turn the head. Inhale, pause. Exhale, turn the head. 2, 3, 4. Again, inhale, back up to center. Exhale, hinging back. Inhale, prepare. Exhale, turn the head. 2, 3, 4. Inhale, center. Exhale, back upright. Keep that going. Pulling the navel in towards the spine, lifting in and up on the muscles that stop your stream of pee, fogging a mirror with each exhale, making sure the belly is pulled in, the shoulders are plugged down. Imagine imaginary hands on your shoulder blades and bring the back ribs towards those hands, engaging your upper back here. Plug your shoulders down. Keep going. So we have 2 full breaths at the bottom, and on each exhale, we turn our head. Shoulders are plugged down. We reset, feeling our pelvis ground towards the floor on the inhale. We brace our abs and turn our head on our exhales. Keeping that going, opening up, stretching the thighs, engaging the lower pelvic floor muscles, kegeling to sustain the lift of the lower pelvic floor for the duration of each exhale. Finish up the one you're on. And we'll keep the purple loop band on. And from here, we're going to come onto our roller lying supine. Our tailbone will be at the bottom, our head at the top. The purple loop band is a little lighter than the gray from level 1. So we're relying more on our core than our legs as we continue to strengthen our internal muscles of the core. So 2 options. First option, the arms are in a chicken wing position. You're going to bring one hand to the ground and the other will stay in this cactus position. You can take one leg up, and that would be the opposite leg of the arm that's up. So if you have your right arm in cactus, your left leg will come up. And if you have your left, your right leg will come up. So this is the first variation. We'll be pulling that chicken wing elbow to the side of the body, and at the same time, lowering the leg, lifting the leg to bring the arm back into cactus. Lowering and lifting together. So that's the first option. If your balance is pretty good and you want to try the second variation, you can take both legs up and you'll move that opposite leg down as the arm goes down to the side of the body in your chicken wing position and then back to center. Taking it down and back to center. So just keep that going on your first side, breathing as you're working. The 2 variations are there. If you're unable to support the movement with those lower abs, make sure as you lower, you exhale. As you lift, you inhale. You feel your pelvis pulling towards the wall in front of you, lengthening on each inhale. You feel your inner thighs and pelvic floor muscles lifting in and up on your exhales. Let's go ahead and switch sides. So that'll mean switching the arm that's doing the chicken wing motion, pulling the elbow to the side of the body, and the leg that is lowering and lifting. Again, exhale to lower, inhale to lift. And both variations are going to work the deepest layer of your core. They're going to activate the hamstrings, They're going to activate under the armpit where the lat attaches as you pull that elbow to the side of the body, opening up the front of the shoulder and the pecs. If you feel gripping in the front of the shoulder, try to soften there. Imagine your shoulder blades pinching the roller. Plug the shoulders down. Soften the facial muscles. Widen the distance between the chin and the chest. And keep going. Breathing in and exhaling out. 2 more. Inhale. And exhale. Again, inhale. And exhale. From here, we'll make our way onto our knees on the roller. So we're going to flip around onto all fours. If you were kyphotic, lordotic, or lordosis prior to pregnancy, then I want you to keep this band on. If you were sway back or flat back prior to pregnancy, take the band off and bring the small anti-burst ball between your inner thighs. Okay, so we either have on the purple loop band or we have the ball between our inner thighs. Our knees are going to rest on the roller. We're going to let our shins come up into the air. We'll point our toes, wrist under shoulders, knees under hips. Now, a bit of the shin is on the roller, so you're not quite on your knees, you're a little more on your shins. We're going to be pulling the knees in a few inches towards the chest and then right back under our hips. So it's a very small motion, maybe 5 inches in, 5 inches back to neutral. It's a reverse crunch. I want you to maintain a neutral position with your pelvis. That means I don't want you rounding your low back as you pull the thighs in. We're pulling from our legs and abs, not from our upper body. So we're driving and initiating from our core and lower body. So inhale, exhale, we pulse in. 2, 3, 4. Inhale, exhale, and pulse. 2, 3, 4. Very simple. Toes are pointing. Inhale. Little mini pulses. 2, 3, 4. And inhale. Pulse it. 2, 3, 4. Continue on like that. I want you to imagine hands hovering above your shoulder blades. Try to bring your upper back and back ribs towards those hands, keeping the shoulders plugged down, the chin lifted, the belly firm in towards the spine. Watching out for rounding in the low back. It's really easy to do as you drive in from your core and your lower body. But can you tilt your pelvis back, pulling in the low abs, lifting up on the muscles that stop your stream of pee, doing those Kegels that will keep you in great shape after pregnancy. Just another 15 seconds here. Hang in there. This is a challenging exercise meant to target the lower pelvic floor and get that low belly back to its pre-pregnancy position, nice and flat. 1 more. Excellent. From here, we're going to keep this purple band around our thighs. If you had kyphotic, lordotic, or lordosis prior to pregnancy, you can keep the ball between the knees if you had sway back and flat back. We need our blue Theraband. That's the blue Theraband. We'll bring it around the arches of our feet, sitting up tall. Neutralize your pelvis, so somewhere between rounding and arching. Sitting up tall, you'll wrap the ends of the Theraband around your knuckles with the thumbs on the outside. We're going to inhale, prepare, exhale, hinging back halfway. Give me 2 rows. 1, 2, pause, inhale, feel your pelvis reach towards the floor. Exhale, turn the head right and left. Right and left. Inhale back to center, up to a tall spine. And we repeat. Exhale, hinging halfway back. Soften the front ribs towards the back ribs. Plug the shoulders down 2 rows. Inhale, prepare. Exhale, turn your head right and left. Right and left. Inhale, center pelvis grounds down as you come back up to a tall spine. So again, neutral pelvis, hinging halfway back. Imagine hands on the shoulder blades. Bring the back ribs towards those hands. And turning the head right and left. Right and left. Inhale, center, all the way back up to your tall spine. Continue on. You have another 30 seconds here to get in as many great sets of these hinge backs for your full abdomen with rows for your upper back strength, head turns to release the tight scalenes in the neck, the side of the neck, shoulders plugged down. Keep imagining those hands on your shoulder blades. Puff the back ribs into those hands. Keep breathing. Inhale. And exhale. Good. Everybody come up to the top. Final set together. Exhale, hinging back. 2 rows. Inhale, pelvis drives down. Exhale, turn the head. 2, 3, 4. Inhale, center all the way up to a tall spine. Great job. Moving over to a wall, we'll bring our 3-pound weight. And you can keep the purple loop band around your outer thighs. We'll sit against the wall. If it's more comfortable for your back to have the foam roller under your knees, you can do that, or you can sit with your legs just extended in front. Make sure the low back isn't rounding. Hold the 3-pound weight in your dominant hand, bringing your upper back against the wall. Wall cactus is here. So let me see that wall cactus. Dominant hand has the 3-pound weight. Imprint the back body, the mid back, the upper back, the backs of the arms, wrists, knuckles, tailbone, head. And once you've found that nice imprint, softening the front ribs, breastbone, and sternum towards the back ribs pressing into the wall, we'll slide the arm that's loaded with the weight up. Inhale, 2, 3, 4. Exhale, lower it down. 2, 3, 4. Inhale, slide it up. 2, 3, 4. Exhale it down. 2, 3, 4. Keep going up. 2, 3, 4. And down. 2, 3, 4. One more. Up. 2, 3, 4. And down. Keep your imprint. Pass the weight to your non-dominant arm. Find your imprint again. Mid back, upper back. Backs of the arms. Knuckles. Head. Tailbone. Belly firm. And begin lifting the arm up. 2, 3, 4. Exhale, it lowers. 2, 3, 4. Inhale, feel your pelvis ground down as it goes up. Exhale, inner thighs pull back towards the wall as it lowers down. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. 2 more. Inhale. 2, 3, 4. And exhale. 2, 3, 4. One more. Inhale. 2, 3, 4. And exhale. 2, 3, 4. Folding over the legs, taking a nice release. If you have any back issues and forward folding bothers the back, I'll give you another variation. But if forward fold feels nice, stay here. Other variation for individuals with back issues, cat and cow. Rounding and arching, moving through spinal articulation. And I would advise inhale to round this, inhale to arch, cow pose, inhale. Exhale, rounding. Inhale, arching. Exhale, rounding. Wherever you are, make sure you're breathing, enjoying moving through that posture or deepening into that forward fold. Another 15 seconds. Stay with it. Keep breathing. And 5, 4, 3, 2, 1. Make sure you have the purple loop band around your outer thighs. From here, we're going to take our red Theraband for some scaption, bringing it under the knees, pinning it. And we'll do unilateral work, sparkler arms with some circling out from the top of the shoulder sockets of the arms. So dominant arm working first. Inhale it up. Exhale, circle. 2, 3, 4, and lower. Inhale, lift. Exhale, circle. 2, 3, 4, and lower. Make sure the top of the feet and the shins are down on the floor. Knees are driving down. Low belly's firming. Front ribs are reaching for the back ribs. Shoulders are plugging down. Check in with all of those checkpoints. They're very important. You've got another 15 seconds on this side. Hang in there. If you need to stop and just roll your shoulder back because you've had enough, feel free to do that. But I'm going to count you down in 5, 4, 3, 2, 1. Switching to the non-dominant arm. Taking it up, circling it out. 2, 3, 4. Lower it down. Inhale, lift it up. Exhale, circle it out. 2, 3, 4, and lower. That's all it is. Inhale, take it up. Exhale, circle. 2, 3, 4, and lower. Again, inhale, lift. Plug the shoulder down. Keep your focus up higher than eye level. Exhale, circle. 2, 3, 4, and lower. As you continue, feel your pelvis grounding down on each inhale as if someone has their hands holding the pelvis and they're driving it towards the floor. Pull the low belly in. Tug in and up on the muscles that stop your stream of pee and try to keep your pelvis neutral. Make sure it's not arching and it's not tucking under like a scared puppy. Just another 5, 4, 3, 2, 1. Setting that red Theraband to the side, we can now come to lie on our abdomen, hands by our chest. Plug the shoulders down, pull the navel in towards the spine, tug in and up on the muscles that stop your stream of pee, and slowly press yourself up to upward facing dog. Inhale, exhale, turn your head. 2, 3, 4. Again, inhale, pause, and exhale, turn the head. 2, 3, 4. Inhale, and exhale, lower down. Keep that going. Inhale, pressing up, and exhale, turn the head. 2, 3, 4, and lower. So hold on a second. Let's shake the hips side to side just to get the kinks out of the low back. Make sure when you're up in this position, your thighs are lifted. You're getting a stretch in the hip flexors. If you feel pain in your low back, just make sure the belly's pulled in and you're lifting up on the muscles that stop your stream of pee. Let's come back up. Inhale. Exhale, turn the head. 2, 3, 4. Inhale, pause. Exhale, turn the head. 2, 3, 4. Inhale, center. And exhale, lower down. 2 more sets. Inhale, lift. Exhale, turn the head. 2, 3, 4. Inhale, center. Exhale, turn the head. 2, 3, 4. Inhale, center. Exhale, lower. One more time, belly firm. Inhale, lift. Exhale, turn the head. Inhale, center. Exhale, turn the head. Inhale. Exhale, lowering back down. From here, taking off the purple band that's on your outer thighs, grabbing your orange loop band, the lightest loop band in the YouniquelyFit kit, bringing it around your outer thighs, and your 3-pound weight. We'll come to lie in a fetal position with our small anti-burst ball under the side of our head. Neutralize your pelvis somewhere between arching and rounding. Plug the shoulders down. Top arm is going to find a right angle, holding the weight. Wrist flat, elbow glued to the side of the body. Top leg is going to hover up. We'll externally rotate the leg from the top of the hip socket as we lift the forearm up simultaneously. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. 2 more. Inhale, 2. Keep your wrist flat. Keep the elbow pinned. 1 more. And from here, we'll slowly make our way up, finding our fetal position, head supported on the other side, shoulders plugged down, neutral pelvis, belly firm, legs stacked, toes pointed. Lift that top leg up, glue the elbow to the side body, forearm flat, wrist flat. Here we go. Lifting up, 2, 3, 4, and lowering down, 2, 3, 4. Try to not roll or rock back. The rotation of the leg is from the hip socket. The torso stays nice and still. The forearm is lifting up. Wrist is staying flat. Keep going. 4 counts to lift on your inhale. 4 counts to lower on your exhale. Think about the energy lines in the body on your inhale, that pelvis reaching down to whatever is below it, towards the bottom of the mat. You have another 20 seconds here. Utilize your time to build strength in the outer hip, in the external rotator cuff, in the lower pelvic floor, working on that pelvic stability. Counting you down. 5, 4, 3, 2, 1. Great job. Let's move into some lower body work. We'll need our yellow Theraband and our foam roller. We're going to take our arms into a diamond position so that we can do chicken wing arms with one arm at a time. We'll start with our dominant arm, bringing our feet onto the roller in a wide leg bridge position like your feet were in the stirrups at the gynecologist. So from here, we'll inhale the pelvis up. And as we tap it down, we will pull our cactus arm in by the side of the body. And then we'll slacken it up on it as we send the hips back up. Inhale. And exhale, pulling down, elbow to the side of the body. Again, inhale, pelvis up. Exhale, pulling down. Inhale, pelvis up. Try to not move the roller. Wrap your toes around it like a bird would around a branch, pointing them. Knees tracking over the second and third metatarsals. Give me one more. And other side. So I've wrapped around my knuckles with the thumb on the outside. And yes, the band may hit your head, but it's not going to hurt you. It's all about engaging the back of the shoulder. See if you can imprint and fight for the front ribs to meet the back ribs and press the back ribs heavy into the floor. The closer those feet are to the butt, the more you'll feel the glutes. The farther away, the more you'll feel the hamstrings. So depending on where you'd like to work, the feet can be farther away if you want it more hamstring focused, closer if you want it more butt glute muscle focused. Okay, so here we go. Let's begin on the other side, the other arm, that chicken wing position. Inhaling to lift up into your bridge. Exhaling to pull down into that chicken wing as the pelvis taps down. Inhale, lift up. 2, 3, 4. Exhale, pull down. 2, 3, 4. Inhale, lift up. 2, 3, 4. Exhale, pull down. 2, 3, 4. Keep that going. Inhale, lift up. 2, 3, 4. Brace your abs. Exhale, lower down. 2, 3, 4. One more. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Set the yellow band to the side. Grab your red Theraband. Now, if you had sway back or flat back posture prior to pregnancy, you can use the anti-burst ball between your inner thighs. It'll look like this. If you had kyphotic, lordotic, or lordosis, bring the purple loop band around your outer thighs. That's my posture, so I'm going to put that on. We're going to take the red Theraband under our bum, gathering the ends of it in both hands, wrapping around the knuckles with the thumbs on the outside. We'll pull out, engaging our upper back. Hands will still stay on the ground, but we're actively pulling out on that band. Our bridging this time is going to be neutral, so we're going to have our legs parallel, hip distance apart. And you either have the ball in between your inner thighs or you have the purple band on so you feel the outer lateral chain of the legs as you lift up. Let's everybody lift up, pulling out on that band, holding it up. Inhale 1, breathe. Exhale 1, 2 breaths. Inhale 2. Exhale 2. Inhale and exhale, slackening in on the band as we tap the pelvis back down. Again, inhale, picking the hips up. Exhale, holding it up. Inhale and exhale. Inhale, exhale, tap it down. And inhale, pick it up, hold it up. Exhale the air out, bracing the abs. Inhale, feel the pelvis reach forward. Exhale, feel the inner thighs pull back, stabilizing you. Use your toes. Pull out on that band that's under the bum. Hands heavy on the floor. Shoulder blades pulling down towards the roller. Collarbone wide. Tap the tailbone down. Final set. Lift it up. Hold it up. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. Inhale and exhale. Tap the tailbone down. Let's everybody, you can place the ball to the side if you have the ball and that red Theraband. We'll drape our knees over the roller And we'll do a little footwork here. So for kyphotic lordotic, E version from the ankle joint, circling away from the body. Inhale, exhale, circle away. 2, 3, 4. Inhale, pause. Exhale, circle away. 2, 3, 4. Sway back posture, the opposite. So if you had sway back posture prior to pregnancy, inhale, exhale, circle in towards the body. 2, 3, 4. Again, inhale, exhale, circle in. 2, 3, 4. And our flat back posture, dorsiflexing the feet actively on your exhales, relaxing the feet on your inhales. Looks like this. Dorsiflex, 2, 3, 4, and relax. 2, 3, 4, and dorsiflex, 2, 3, 4, and relax. So we have a pausing component where we're not working, and we have our moving component, either flexion, dorsiflexion for flat back, inversion, turning the feet in towards the body for sway back, eversion, turning the feet away from the body for kyphotic lordotic and lordosis. So I've demonstrated all of them. You keep going. We've got another 30 seconds here just to work those feet before we come up to stand and begin our cardio in a bit. So keep that going, using your breath. Another 15 seconds. Inhale, pause. Exhale, move. Inhale, pause. Exhale, move. Last set. Inhale, pause. Exhale, move. Final lower body exercise in our lower body strength work. We're going to, if you had sway back or flat back prior, keep your anti-burst ball between your inner thighs. We need our red Theraband again. Lordosis and kyphotic lordotic, put the purple loop band around your outer thighs. Okay, so prior to pregnancy, if you were lordotic or kyphotic lordotic, purple band. Anti-burst ball if you were sway back or flat back. Now, if you don't know, both exercises are fine. Just think about your feet. Do you roll in or out more? If you roll in, you're going to want to use the purple band. If you roll out, you're going to want to use the ball. If you're kind of in the middle, you can try both variations. So from here, the red Theraband is now going to go over our thighs. We'll wrap around both hands, knuckles with the thumbs on the outside, and we'll push the hands down, creating some resistance as our pelvis goes up. We'll extend our legs long on the roller, and we're going to do some hamstring curls. We'll inhale, lifting up, going in and out 2 times, and then lowering the pelvis back to the floor. So inhale up, exhale out. Inhale up, exhale out, and lower. Again, inhale, lift. Exhale out, inhale up. Exhale out, inhale up, exhale, lower. And really push down with the hands. You'll notice that that red Theraband creates nice resistance. It also helps with a little counterbalance. So it's a nice tool to use. You've got another 20 seconds here. Make them count. Legs are hip distance. You're rolling over the heel, up onto the feet, and then back over the heel. Keep it going. 2 at the top, and then you lower. Shoulders plugged down. Use your abs. Neutralize your pelvis. Soften your facial muscles. Press the back ribs into the floor. Finish up the one you're on. And let's set all of our props to the side. Take off the loop band if it's around your outer thighs. Come to a comfortable seated position. If you have no back issues, take a forward fold over the legs, pointing the toes. If you have back issues, find your way onto all fours. Now, if you have knee issues, I'm going to give you another option. All fours, begin your cat and cow if it's back issues that you suffer from. Inhaling to come into cow, exhaling to round. And if you have knee issues, you can do this cat and cow position with your hands on a chair. I'll show you that variation now. So lots of different variations to keep you safe and feeling good as you're working here. Another 30 seconds, hands on the chair. I'm showing you this variation, but you can be folding over the legs if you don't have knee or back issues. You can be in cat and cow if you just have back issues. And if you have knee issues, you can do cat and cow with the hands on the chair. So keep that going. Another 20 seconds, using your breath, getting into the flow of it. I like to cow pose when my chest and chin are lifted and tailbone's up. Inhale and round on my exhale, bracing my lower abdominals. Give me a couple more breaths. Great job.